Ladies and gentlemen, thank you very much indeed to Dr. Boran for inviting me to give this talk about William Hunter's casts of the gravid uterus at the University of Glasgow. If I move to the first of the slides. This is the Joshua Reynolds portrait of William Hunter, which is at the University of Glasgow. William Hunter lived from 1718 to 1783. He was brought up at East Kilbride, not far from Glasgow, and attended Glasgow University when he was in his teens. But he very quickly decided to move in a medical direction, and before too long, he went to London, where he spent the rest of his career. And he established the very famous Windmill Street School of Anatomy, and he became the obstetrician to Queen Charlotte. Now, Dr. Boran, can you keep me right? Can you see a pointer coming out at the moment?
Yes, I can.
You can, excellent. So if you look carefully at this picture, you'll see there's actually a cast here, quite a small one on the table. And equally interesting, there's a specimen in here, which we still have in the Anatomy Museum at Glasgow, showing a uterus. Now, at one time, there were, according to Hunter's manuscript catalogue produced in his own lifetime, there were 21 casts. But these days, I don't know what happened to 10 of them, but some of which were wax. But the Hunterian Museum currently has 11 casts. And I'll move to this extract from one of William Hunter's lectures. Now I'm going to show you the casts, and I'm simply going to talk through the casts and show you the anatomy and some of the detail that they contain. But before I do that, I'm going to read to you this extract from one of William Hunter's lectures. And this shows you the use that William Hunter made of these casts. You see, we're talking in a time when dissection wasn't nearly so possible as the previous speakers were speaking about. And even today, you wouldn't see what the inside of a gravid uterus looks like in reality. And these casts allowed that to happen. They were useful to Hunter's students. They were useful to me through my career in anatomy to give me the picture of what the uterus looked like. Hunter said, "I shall show you some real preparations of the gravid uterus, and also some others in plaster of Paris. And in the last, all sizes of the parts with their shape and situation are exactly as in nature herself. We have a good many of them to help us on. They are most useful, especially where it is so difficult to get a subject of this kind to explain upon in a course of lectures." Now here's the first of the casts. As you see, these are life size. They're casts made from dissections, understand, by placing soap or oil over the dissection and putting on a plaster mold and then sort of reversing the process to produce the cast. And you can see that they've been extremely well painted as well to give a very realistic and sort of rather shocking effect to some extent. Now, for my whole of my career, my office was just off the Anatomy Museum, and these specimens were just outside my office door, so I'm quite familiar with them. I'm going to talk you through them now. So this one here, the casts have recently been restored, have been moved into the main Hunterian Museum, but they were mounted on black boards, as you can see in the cupboards. This one here has been quite radically dissected, and you can see up at the top, we can make out the diaphragm with the liver just underneath it. I think some fat has been taken away here, and we can see lots of coils of intestine. And here is the uterus at full term, sitting here in the lower part of the specimen. The abdominal walls have been cut away largely, but here's some flaps off them down here and down here. So there's a cast of the pregnant uterus at full term at the end of pregnancy. Now, Hunter, of course, produced the very famous book, The Anatomy of the Gravid Uterus, exhibited in figures, which was published in 1774. And this cast corresponds to one of the specimens that's illustrated in the book. And I'm going to show you a similar illustration from the book, but it's not quite the same as the specimen. And there we have it. And you'll see the main difference is that the chest wall is still here in the illustration. The lower part is much the same. Now, we know the history of this. This was a woman who died in 1750. Hunter says she died of a flooding. She died of a hemorrhage close to the time of birth. And Hunter he made specimens, and Jan van Rimsdijk illustrated the specimens, and various engravers engraved the figures for the book. So that's the first of the specimens. Now, if we move to the next one is very like it. It's almost the same, in fact, except that a piece of cloth has been put over it and painted. And the difference from this one is the lower part of the abdominal wall has been removed, and we can see more details of the birth canal, and we can see more of the peritoneum here and some of the muscles of the lower part of the anterior abdominal wall. I'm just seeing the uterine tube, the fallopian tube coming down from the uterus there on that left side of the subject. So moving along, and there's a very similar picture in Hunter's book. And then if we move to the next picture, this one here, this is, I always think, is the finest of the casts. A very similar view to the previous one, only this time the uterus has been opened up, and we can see the baby inside. You could almost imagine that baby's hair was wet there in the picture. The placenta, I think, has been in the front of the uterus, as it often is, and has been cut away. And there's the umbilical cord, and that must be a piece of the placenta sitting just in there. Again, we can see some coils of intestine under the cloth, and there's the abdominal wall flap to this side and this side. Now, you can see in the picture there's cut off limbs, and people have written about these and said that they were very shocking, and they increase the impact. They certainly do. And people have speculated that these have been done to increase the shock element. My feeling is that the artist has created exactly what was seen, and I think it's much more likely that Hunter simply had removed the lower limbs for use elsewhere in the dissecting room. And you can see the cut bone, and you can see the cut muscles, and the paintwork makes them look very fresh indeed. You'll also notice an incision here that's been stitched up in this thigh, and the same on the other side. And that, I think, is where William Hunter has injected coloured molten wax to show up the blood vessels different colour. And the anatomists in the audience will be able to recognise there the external iliac artery just before it becomes the femoral artery as it comes into the thigh, shown in red, and the external iliac vein on its medial side there shown in blue. What else can we see? So we're seeing there the cut edge of the uterus there, and you can see this is a normal fetus at full term. We know from the history this was a woman who died of a hemorrhage, but there's nothing obviously wrong there in the picture. And this is the engraving here was done by the famous Scottish engraver Sir Robert Strange, who knew William Hunter. And that's a very fine engraving of the same thing. Let's move along to the next picture. Now, this one here is one which is at full term again, and this seems to me to be an entirely normal fetus and a normal uterus. Something has clearly gone wrong when the patient has died, but the cause of death is not obvious, nor do we have any history for most of these casts. These first three casts are the only ones where we know the history. This time you can see the flaps of the abdominal wall, the upper parts turned out to the side and the lower parts turned aside to let us see into the abdomen. There's the colon, the ascending colon, and the transverse colon, and part of the descending colon there surrounding the uterus. And we can see the cut edge of the uterus in there. Perhaps some placenta there, but and you'll see that the baby's head looks as if it's just starting to perhaps engage in a normal looking fetus there. So we move to the next of the casts. Now, there's problems here this time, and again, there's no history for this one, but I think we can start to see what the problem has been, and this is likely to have been. Here we see the baby is presenting by the breech, and a breech delivery is always more dangerous than a normal head-first delivery. What can we see in the picture? We see the breasts up here, we see I think that looks like liver there, there's the stomach sitting in there, the colon surrounding the uterus, similar to the previous one. I think for anatomists that looks like a piece of greater omentum that has been lifted up and slightly laid over the chest. Down at the bottom, there's the flaps from the abdominal wall. Here's the placenta sitting in here, partly uncovered by the removal of part of the uterine wall. And there's the umbilical cord, which happens to be kind of coming around the side of the baby's neck in this particular instance. So a breech presentation, I think that gives students, and certainly has given me a very vivid picture of what a breech delivery actually looks like. So I would like to think that these casts made so long ago by William Hunter were still informing students who see them today. Let's move to the next illustration. Now this is the first of a set of three, and I'm going to show you three stages of a dissection that are shown in these three casts. Only the first three have these cut off legs. The legs have been cut off here, but they're featureless if you look at the end. They don't have that feature. But notice that it's not just the uterus that's very realistic, but the whole of the specimen is very realistic. And even the breasts, if you look at them closely on the actual cast, seem to be to have the Montgomery's tubercles, the little elevations that are a feature of the areola of the breast in a pregnant patient. We're seeing here the abdominal wall cut aside, just similar to the previous ones, just there's been a cruciate incision and the flaps have been turned to the side. And there's the uterus, and we can just about make out the baby sitting in there. And we can see coils of intestine. Next one, there's a very similar view. Now, I wonder if anyone can see here what might well have been the cause of death, I suggest. I wouldn't like just to go to court and say this, but it seems to me that what we're seeing here, I think that's the edge of the placenta down there. And you'll notice that it's covering the birth canal. I think this is a patient who has placenta previa, where the placenta has situated itself over the cervix, so that towards delivery, the hemorrhage is likely to happen. And I suspect that is what has happened here, although there's no history for the patient. Again, it's the same patient as before. We can see that the flaps turned aside from the abdominal wall, a piece of colon sticking out there. But this time, the uterus wall has been opened up, so you can see an extra set of flaps where the wall of the uterus has been opened up. And therefore, we're seeing the amnion, the sac in which the fetus is situated. And we can get an idea of the head of the fetus and its arm coming up there, and we can make out this is going to be a breech presentation as well. So it looks to me as if we've got two problems here, a breech presentation, but what looks to me like a placenta low down in the uterus. Notice the clever way there that there's some defects here. There's been some chips over the years, and these the Hunterian Museum has just been restoring the specimens and the paintwork. But notice the very clever brushwork, just by means of some flecks of white paint, has given the impression of seeing through the amnion and the fetus into the fetus beyond. The painting has given the impression of a thin membrane in a very, very effective way. And this is the third picture in the series. Again, you can see the very realistic chest up here. Here's the amnion now has been turned aside, and we're actually seeing the fetus in there. This one always looks to me as if the fetus is slightly flattened, and I don't know whether it's just been that the casting hasn't worked quite so well, or is that a post-mortem effect that things have been sitting for a little while and a rather more flattened appearance has appeared. I wouldn't like to particularly comment other than to raise these possibilities. And again, you can see a piece of colon there, and I'm not sure that that's the umbilical cord. It may just be a fold, but we're seeing the fetus presenting by the breech. And now if I move to the last of the 10 casts, there is an 11th cast, which is the same as the first one with the fetus in position, which is made of lead rather than plaster of Paris. Here's the last of the plaster casts. So, and this I always think is I think it's the second last one. This is a horrific specimen showing an obstructed labour. And you can see there, there's the uterus there, but look at the bowel, it's hugely distended. It's very realistic though, because you can see the fatty tags, the appendices epiploicae, and you can see even the strand of smooth muscle on the surface, the tinea coli running along there, anatomically very accurate indeed. Here's the uterus, and here's a very distended urinary bladder. So a horrible specimen with a hugely distended colon and a hugely distended bladder. And just looking at that, it looks just to my eye, you might just wonder if that patient had a slightly narrower pelvis than many of them. Many of these patients at Hunter's time had rickets, and that may have been part of the problem here that has led to the failure for the delivery to work properly and has led to the obstruction. And the last of the specimens I want to show you is one of a pregnancy at 6 months. And this one was right outside my office door in anatomy. And I found this very, very useful just to picture what a 6-month fetus looked like. Folks who've done obstetrics might remember at about 20 weeks, the fundus of the uterus comes up to about the level of the umbilicus, which I would have thought was about here. About 36 weeks, it comes up to the sternum up here. So the fundus of the uterus is just at the right height for being in the 6 month. And there we can see the colon again arranged around the uterus, the fetus in situ, and a rather smaller umbilical cord than in the previous ones. And you can see the urinary bladder down at the bottom there. So a very, very useful specimen just to give people a mental picture of what a fetus looks like at 6 months. So everyone, the University of Glasgow, I think, is very, very fortunate to have the Hunterian Museum. William Hunter left his collection to Glasgow to help inform the people of Glasgow and the west of Scotland. And I would like to think that very good use is still being made of these specimens. And many, many thanks for your attention and for a very kind invitation. Thank you.